Decoding lazy bowel muscles, slow transit. Why does gut motility weaken, causing chronic constipation? How does dehydration cause stool to become rock hard?
Why doesn't the pelvic floor relax during defecation?
Decoding constipation timing. How does the circadian rhythm affect the morning urge to defecate?
How does stress slow down bowel activity? Magnesium helps relax smooth muscle and draw water into the colon. Decoding ignoring the urge, the rectal reflex. How does habitually holding it in dull rectal sensitivity? Decoding milk consumption and adult constipation. Does lactose intolerance cause constipation or diarrhea? Distinguishing the mechanism.
Experiment the squatting posture trial using a stool. Counterclockwise abdominal massage. Stimulating peristalsis in the direction of stool passage.
Drinking hot water upon waking. Activating the gastrocolic reflex.
Day 1, learning to relax while pushing. Day 3, improved relaxation. Day 5, consistent relaxation achieved. Day 7, optimal relaxation mastered.
Do fatty acids help lubricate waste and reduce gut inflammation?
So why does the bowel become dependent and lazy? Understanding the underlying mechanisms behind this phenomenon is crucial. Why does prolonged sitting increase venous pressure and hemorrhoid risk?
Experiment 30 minutes of chronic movement daily, stimulating peristalsis through body movement.
Why does the valve open unnecessarily? How does a weakened diaphragm allow acid reflux?
Why does acid stay in the esophagus longer when lying down?
How do these substances relax the LES valve and increase reflux? Abdominal fat creates physical pressure, pushing acid up the esophagus.
How does stress stimulate stomach acid production?
Decoding the habit of wearing tight clothing. Physical pressure on the lower abdomen increases GERD.
Excess air creates pressure in the stomach, causing belching and reflux.
Decoding smoking and GERD. Nicotine relaxes the LES and reduces saliva secretion, an acid neutralizer.
Decoding sleep deprivation and burning sensation. Lack of sleep increases the esophagus's sensitivity to acid.
Elevating the head of the bed 15 to 20 centimeters allows gravity to help keep the acid in the stomach.
Chewing thoroughly, 40 times per bite, measures increased saliva production and reduced air swallowing.
Stress reduction. Vagus nerve activity. Stomach acid production.
Sleeping on your left side may actually alleviate acid reflux.
Experimenting with ginger and turmeric water, analyzing the anti-inflammatory and natural anti-reflux effects.
Experiment diaphragmatic breathing training, strengthening the diaphragm muscle to support the LES valve.
This mechanical pressure stretches the LES sphincter muscle severely.
No water during meals. reducing liquid volume in the stomach, avoiding acid dilution. Decoding the effect of baking soda claphid. Quick neutralizing effect, but why shouldn't it be used often? Decoding H. pylori bacteria. How does this bacteria destroy the protective mucus layer and cause stomach ulcers?
How do these drugs destroy the stomach's protective lining?
The mucus layer contains bicarbonate that neutralizes acid before it reaches the stomach cells.
How does alcohol directly damage mucosal cells and cause acute inflammation?
Decoding sleep loss and ulcer recurrence. Lack of sleep reduces blood circulation and growth factors needed for healing.
Decoding the habit of excessive dieting. Skipping meals or eating too many irritating spices causing harm.
Stomach acid is essential for B12 absorption. Acid reduction causes nutritional deficiency. Small, frequent meals, measuring acid stability and reduced pressure on the ulcer site.
Decoding the use of DGL. Mechanism of increasing natural mucus production without raising blood pressure.
Decoding diuretics and constipation. How do these drugs reduce systemic water, causing constipation?
Experiment, sitting nap. Optimizing rest without causing reflux.
Experiment. Liquid nutrition during acute ulcer stage. Minimizing the stomach's workload. How do antibiotics cause constipation or diarrhea?
Hello, and welcome to this experiment on the pain reduction breathing technique.
Fat slows gastric emptying and relaxes the LES.
The mechanism of excessive gas fermentation.
Experiment, applying heat to the abdomen. Stimulating blood circulation and relaxing gut muscles.
How does the habit of eating spicy food affect the mucosa? L-glutamine supplementation. This amino acid helps repair the stomach and gut lining. Diaphragm self-massage can help reduce respiratory muscle tension, which can also affect things like GERD, the impact of strong acid spikes when hungry. It then passes undigested into the large intestine, where it can feed beneficial gut bacteria.
Decoding the danger of vaping on the stomach. Chemicals and nicotine still damage the mucosa.
Experiment, apple cider vinegar for GERD. Does it balance acid or worsen it? Scientific mechanism analysis. Here is a demonstration of how proper diaphragm positioning can help to strengthen your spine. Decoding long-term consequences of untreated stomach ulcers, bleeding, perforation, and malignant transformation.
Decoding sleep arousal and acid. Acid reflux stimulating mild waking.
Repeat deep breathing training. Reducing constipation and tension. Meds relax muscles, including the LES.
Cold nutrition, reducing swelling and soothing the mucosa.
Decoding age-related constipation, reduced gut motility, and decreased rectal sensitivity with age.
Walking 15 minutes after eating. Stimulating peristalsis and gastric emptying.
Decoding the habit of eating and drinking quickly. Increased air swallowing, bloating, and GERD.
Warm bath therapy. Relaxing the body and reducing stress on the digestive system.
Decoding impact of stress and sleep disorders on stomach mucus.
Compressing the abdomen and pushing acid up the esophagus.
14-day digestive journal, tracking the link between food, stress, and disease symptoms.